There is so much beauty in our differences. No two people are alike, and each of us has characteristics that make us uniquely and distinctly us. But there's mystery in those differences too, especially when it comes to medicine. In the past, diagnostics allowed us to generally understand a disease, but analyzing, understanding, and treating its unique properties were out of reach. Until now. The future of healthcare is here. Diagnostics are an important part of every stage of medical care. In fact, 70% of medical decision-making is influenced by diagnostics, and that makes molecular diagnostics one of the most important advances in the last century. Simply put, molecular diagnostics are tests that detect specific genetic sequences and proteins to help make individualized and therefore more effective medical decisions for patients. The Society for Women's Health Research works to understand diseases and conditions that affect women more than or differently from men. We know that in every instance, from cardiovascular disease to cancers, molecular diagnostics provide the critical insights we need. Mental illnesses are some of the most challenging to diagnose and certainly the least understood. About 1/4 of all Americans will face mental illness in their lifetime. Depression is one of the most common mental disorders, and women are 70% more likely than men to experience it. Treatment is often trial and error. Half the time the initial prescription doesn't work, and different medications are tried until one does. This is frustrating, time-consuming, and potentially dangerous. Technology now exists to use a simple blood test to determine what will work the first time around. Variations in our genes affect our response to antidepressant and antipsychotic medications. Molecular diagnostics measures and analyzes these variations in our blood, giving us a personalized picture of which medicine best fits our distinct genetic makeup. The technology also shows great promise for helping to unlock the answers to treating other diseases, like seizure disorders and Parkinson's disease. The future is here. These advances revolutionize how we approach diagnosis and treatment of hundreds of diseases, including lung cancer, HIV/AIDS, cystic fibrosis, childhood cancers, and Alzheimer's. The Society for Women's Health Research believes in the promise of molecular diagnostics, which is improving the quality of life for millions of people. It's an exciting evolution in healthcare that is already transforming health in ways never before possible. To learn more about molecular diagnostics and the biological differences between women and men, visit swhr.org.